Okay, prior to inspection, first we're gonna wash our hands. And then to do the inspection, I do need you to lift up your shirt for me, just so I can see your abdomen. Perfect. And again, we're looking at color. We're gonna see if there's any kind of scars, any masses that we can see from the abdomen. We can see that it's symmetric. There's no kind of distension. Now we're gonna listen to the abdomen. We do this first before palpating or percussing because we don't wanna alter any of the bowel sounds. What you're supposed to do when you listen to bowel sounds with the diaphragm and the stethoscope, you're supposed to listen to each quadrant for 5 minutes. But for the sake of this video, we'll listen for about 10 or 15 seconds per quadrant. We're gonna start with the right lower quadrant and go in a clockwise formation, okay? All right, you ready?
Mm-hmm.
Quick listen, okay?
Is your stethoscope warm?
No, it's not warm.
Okay.
Ish, warmish. Okay, here we go. After listening to the patient's bowel sounds, we heard between 4 to 35 gurgles and clicks per quadrant, which gives her a normal active bowel sounds. Also, we listened for bruits in those. Now we're going to percuss the abdomen. This will be using 2 fingers, and we're going to, again, start in the right lower quadrant and make our way around, okay? So we're gonna start here. Okay, so she does have a normal distribution of tympani and dullness throughout. We're gonna do light palpation, so this is just gonna be with one hand, and we're going to feel the abdomen for any kind of superficial masses or hernias, or see if there's any tenderness upon touching. All right, so we're gonna start again at the bottom. So quick touch. Does that hurt at all? No pain, no tenderness. Okay, so upon a light palpation, there's no tenderness per the patient. There's no feelings of masses or hernias. The abdomen is soft. There's no distension. After light palpation, we're going to move forward with deep palpation. So we'll be using 2 hands instead, and we're going to do the exact same thing. But now I'm going to see if there's anything I can feel deeper instead of superficially. Okay, so with 2 hands, push a little bit deeper. Again, is there any pain when I do this? No. Okay. Last one. Okay, so again, even with deep palpation, there's no feelings of any kind of palpable masses and no pain. So lastly, after percussing, palpating, we would assess for signs of peritonitis, but because she's not in any pain, there's no indication to do this. But we would look for a positive cough test, rigidity, palpation tenderness, percussion tenderness. We could also look at rebound tenderness too. But again, because she's not feeling any pain, there's no indication. Next, we're going to percuss the liver. This is done to help us approximate the size. So we're gonna start well below, well, right about the umbilicus, and we're gonna percuss up into the rib cage, okay? And we're looking for sounds of dullness, and we're gonna go all the way up into about the sternum and palpate, or not palpate, and percuss. And we're gonna feel that dullness, okay? This again, we're just gonna help to see if we can measure the liver span, all right? So we're gonna start here, give or take. Okay. It stops about right here, give or take. So I would estimate the size of the liver to be about 7 centimeters. So after percussing the liver, we're gonna move on to palpation. And this helps us to really evaluate the surface, the consistency, and the tenderness of the liver. So again, using my hands, we're going to start well below the right costal margin. And we're just gonna go ahead and feel to see if we can feel that liver, okay? Here we go. Sorry, you okay? Does it hurt?
No, I'm just ticklish.
Just ticklish, okay. Okay, we can feel it right here. It's about 3 centimeters below that right costal margin. Sorry. Just ticklish, right? No pain?
Just ticklish.
Okay. So upon palpating the liver, that liver edge is distinct in outline here, and it is smooth, and there's, it's a smooth surface, and there's no tenderness upon palpation. My patient is just a little bit tickled. Okay, after the liver, we're gonna move on to the spleen, and we're gonna do a percussion of the spleen, okay? So I'm gonna stand on this side, reach over, and we're gonna do this through the semilunar space or trough space. So we're just gonna go to the anterior chest wall around the 6th rib marking, and we're gonna percuss that way, okay? You ready? Don't be ticklish, it's okay if you are. So we're gonna start back here. Okay, and after percussing, all we hear is tympany. There's no dullness, because the dullness would indicate splenic enlargement. Now we're gonna try to palpate the splenic edge. We're gonna have the patient lay supine, just as she is. Hands are gonna be by her side. And what I'm gonna do is I'm gonna reach behind and support the left back, and then try to palpate under the rib cage, that left side. So I'll ask her to take a deep breath, which will hopefully help push the spleen out and try to palpate, okay? All right, so you're gonna feel me touch you here. Go ahead and take a deep breath for me and hold it. Okay, so I wasn't able to feel it, so what we're gonna do next is I'm gonna ask you to lay on your right side. Okay, so now we are going to palpate the spleen, but instead of laying supine, we're gonna turn you to the right side. Okay, so this is called the lateral decubitus position, I believe. So yeah, you're just gonna lay on your right side. This is gonna help bring the spleen downward so that we're able to palpate that splenic edge, okay? And I'm gonna help push it out this way, give or take. Does that hurt at all?
No.
Okay. So that splenic edge is about right here. Yeah, sweet. So yeah, that splenic edge is slightly palpable. Okay, so next we're going to percuss the kidneys. This is done using the costovertebral angle. So I'm gonna put the palm of my hand on your backside on both sides, and then I'm gonna hit it with a fist, okay? And if it does hurt and it comes with like a fever or like urinary pain, like when you pee, then that's indicative of pyelonephritis, okay? So I'm just gonna sit next to you, and then you just let me know if this hurts at all, okay?
No.
And last, we're going to percuss the urinary bladder. Unfortunately, my patient just peed. She drinks a lot of water, so she wasn't able to hold any of it in. But because of that, we shouldn't hear anything upon percussion. Had the bladder been full, then we could feel hear some kind of dullness. But we're gonna percuss anyway, just in case there is any abnormal distension. So it's gonna be about right here, give or take, right above that symphysis pubis. Okay, top will come up, about right here. So yeah, I wasn't able to hear anything, and because her bladder's empty and undistended, it's not palpable either. But thank you so much for being my patient on this abdominal exam.